What you have, Frugal Innovation. This guide for community health initiatives is brought to you by Alberta Prevents Cancer and the Cumming School of Medicine at University of Calgary, as well as the Healthy Communities Alberta Approach team. You can learn more about us and the Healthy Community Approach on our websites and through the list of resources at the end of this series, so at the end of part 3. So part 1 podcast asks, what is the work with which you have approach and frugal innovation? So let's start with our roadmap. We'll give you a bit of an outline for this podcast series. Learning objectives. At the end of this series, you should be able to take what you've learned about frugal innovation and have the examples and tools to apply that to help drive positive change in your community. We'll start with part 1, this series, which is about the concept of frugal innovation. This series is presented as a podcast, which means it's a recorded presentation. We'll walk you through slides, videos, and web links, so just click on your mouse or the arrow keys to advance to your next frame. You might need to adjust the volume for the videos, so just keep an eye on that. At the end of part 3, we'll have a feedback form from you and contact information, as well as our resources and the opportunity for you to provide us some feedback. So let's get started with part 1, the concept. So what will you learn in this brief podcast? Well, we'll look at what is a frugal innovation and take a look at a couple of different examples. There are many examples of groups coming together to use their own resources to accomplish a shared goal. That's frugal innovation. Frugal innovation as an approach and the evidence surrounding that approach comes out of many years of work in low resource settings. So for example, you'll see on the right side there's a picture of the Stadiometer, which is a locally designed height measure built with local resources for clinics in Uganda. Now, closer to home, you might look at things like potluck meetings, volunteer run events, donated items, and using homemade tools in your initiative as ways to advance frugal innovation. If you're interested in learning more, there's a reference to a BMC Medicine article from 2016 that shows 4 different types of frugal innovations if you want to learn about the categories. That's in our resources. Now, work with what you have may be an ideal approach to adopt when external funding is not available to you. So sometimes there's no funding for a variety of possible reasons. It could be your group doesn't have a track record yet to convince a funder to give you money, or funders that you've used in the past may no longer have those resources available, or they might have changed their priorities. Your group might not meet standard eligibility requirements like having registered charitable status in Canada, or you might not have matching cash available that's required for certain types of funds. So let's take a look at an example of a group that worked with no resources. So they were facing a challenge with their community health initiative due to lack of funding. This is Lisa's story. The Airdrie District Hospice Society Board, Lisa was the chair, faced challenges in finding funds to construct and staff a hospice. A palliative care physician suggested a community capacity initiative in the meantime to support end-of-life care using the resources they already had. So participants got together and explored what they had to bring to the community, and they began to appreciate the passion and skills of the community volunteers. Building on that learning, the group determined to expand volunteer care, expand support, respite, and set up a system of referrals using their own networks. As well, they started a grief follow-up program. While they continue to seek funds for a hospice, they are working with what they have to enable Airdrie residents to have end-of-life supports in their home community. So, a couple of questions to think through related to this story for yourself. What type of volunteer commitment is needed for your community health initiative? Is it burdensome? If you're not sure, you may want to talk to some volunteers about what they do and learn about how best you can balance their efforts as you go forward. Now here, we're just going to flip to the community dashboard data. We'll start over here. So Alberta Prevents Cancer on their website has something called the Community Data Dashboard. So when you click on Alberta Prevents Cancer, you'll see prevention data at the top. Click on this. It'll take you down to the Community Data Dashboard, and this screen will come up. So on the right, you'll see here we can look at community success stories if you want to learn some more about what other communities have tried. You can learn about collecting data within your community. And this third one will take you to the Community Cancer Prevention and Screening Dashboard, which is where we're going to go. So we'll just click here where we've pulled it up. This is the home page for the province. You can see here we've got the general demographic info about the province, right? Our population size, percent of seniors, percentage of immigrants, etc. And then on the right-hand side, we've got socio-demographic data. So right here, you just come in and you type in the postal code for your community, and it will take you just to that spot. So here is what we found with the postal code for Airdrie. So you can see right up here is the Airdrie story. So here's some information for Airdrie that's useful to take a look at. Now, how can this help you design your own community health initiative? Well, each of these icons over here give you a little information about the link. So for example, higher income is often linked to better health. So if you're in a higher income community, you might expect to see some better health outcomes. If you find you've got a significant proportion of low income people in your community, then you want to design a community health initiative to really target some of those people who might be facing poor health. So this is on the home page. Let's just go up to the top here. You'll see next to that the risk factors. So let's look at the risk factors for Airdrie. So what comes up here are risk factors related to cancer incidence. And the blue is better than provincial average, the green is provincial average, and red is worse. So Airdrie's got a couple of places worse. So let's look at sunburn. As you can see, sunburn rates in Airdrie are at 53.4% in 2015-16 from a survey. Compare that to Calgary zone at 40% and the province 41.5%. So you can see that Airdrie has definitely higher sunburn rates. So that might make you, how could you use that in your Healthy Community Initiative? Well, if you're doing something around, say, a pathways system to promote more physical activity, then you might want to add some sunshades, for example, at some benches along the way to try to reduce sunburn incidence and maybe a little bit of information about sun safety at those stops so that people in the community become more aware. So think about how you can use all of these risk factors indicated here to inform your community health initiative and just make it better. Now that we've looked at the homepage, this is the risk factors. Let's take a peek at screening and immunization for Airdrie. So here it is. We find out that Airdrie looks like they're doing pretty well on screening rates with the exception of colorectal cancer. You can see there the screening rate is not far from the Calgary zone and the provincial average, but you do see there that it is looking a little higher than what you see in the rest of the region. So let's say you wanted to think about how could you use this screening data in your program. Well, another resource we have here is screeningforlife.ca, which is actually also from Alberta Health Services. And you'll find information here about the screening data that's presented on the dashboard. So if you check on the colorectal cancer, it'll tell you a bit more about what you can do and what's available to communities across the province, including rural and remote communities. You can look at an FIT test for an at-home test that you can do. So there's information there about that. Within the province right now, the one mobile screening program that's traveling to remote communities is breast cancer screening. So if you do find that's high, take a look at that one. You can check out the resources. There's a list here of communities, rural communities, that the mobile screening program covers. So that gives you a little bit about how to use the dashboard. So let's come back here and take a look at whether or not you would want to consider a frugal innovation project, even if there's money available. Well, sometimes you might. External funding may take your project idea off course, and you might decide to run a frugal innovation and work with what you have instead. That's a judgment call for your group. So here's some things to talk through in your community to decide whether or not you want to go it alone or look for external funding. So if a funder wants you to change your priorities, but you don't think it's a good idea, consider a frugal innovation. If they want a detailed plan up front, but you're not exactly sure where you want to go, maybe you want to pilot an initiative in your community and test things out first on your own. You might actually find out that you have enough local assets in the community to make things happen. Or you might find the grant administration burden, the amount of reporting, for example, and paperwork outweighs the benefits of the funding, or it could be too much for your volunteers. So you want to look at all of these different kinds of things and take these issues into account. Navi Rajdu, who's a co-author of the book Frugal Innovation, has this advice if you do decide you want to go with a frugal innovation. Number 1, keep it simple. Number 2, do not reinvent the wheel. And number 3, think and act horizontally. That is, he's referring to the business community, and that my interpretation would be, it means developing networks of small, interlinked initiatives instead of creating a large centralized program. And again, we've got, if you're interested in learning more about frugal innovation, we've got some of that in our resources section at the end of part 3. So if you decide to go with the work with what you have approach, what might be some of the benefits to you of that? Well, you can find hidden gifts and talents within your community, build your track record for those grants that want you to demonstrate some success working together. You can use it as an opportunity to really rejuvenate your volunteers. And it's a brilliant chance to really celebrate resiliency and build community and pride in what you're capable of carrying out together as a group. Now, it's interesting to think about these benefits in terms of the Airdrie and District Hospice Society example, Lisa's story. Clearly, the group found hidden talents and they rejuvenated their volunteers. So a great success. So which of these might apply in your Healthy Community Initiative? So this wraps up podcast part 1. What is the work with what you have approach and frugal innovation? So at this point, you should understand the concept of working with what you have, and have thought a bit about whether it applies to your community health initiative and what potential benefits you might have. So next up is part 2, local resources. I'd like to thank you for participating in part 1 of the Work With What You Have podcast series. This presentation was developed in 2018 as a joint initiative of Alberta Prevents Cancer, a program of Alberta Health Services, and the University of Calgary Medical School Engagement Hub. We use the Healthy Communities approach, which aims to empower communities to build capacity to address local health needs for cancer prevention and overall community wellness. If you'd like to learn more or get involved, please contact us. We've got the information there on the screen.